I'm Tod Robberson, editorial writer of the Dallas Morning News, and we're here to talk to the 3 Dallas Morning News Texans of the Year for 2014, Dr. Kent Brantley and registered nurses Amber Vincent and Nina Pham. Welcome. You're all three people of very strong faith, and I'm just curious, how has your faith played a role in this entire experience?
From the beginning, my diagnosis, I knew that it was in God's hands. So I would pray always for myself and for my colleague Nina, too, that we would make it through.
I think my faith and this experience are inseparable. I contracted Ebola because I was trying to live out the calling that God has placed in my life. And so when I was sick, I didn't question, should I have been here, should I have done, I knew I was where I was supposed to be. And then after recovering, people have asked me, do you think God gave you Ebola so that you could help other people? Well, I don't believe God gave me Ebola, but I believe He saved my life, and I now have a responsibility to live in a responsible way. And I'm glad that I've had the chance to do that.
Nina?
I think faith played such a big role in my recovery process, just praying every day, relying on prayers from all around the world. I've gotten so many prayers and cards and well wishes from everyone from all over the world, praying for me, Bentley, Amber, all the other Ebola survivors. So it's just been very heartwarming and humbling to know that so many people care.
What have you learned from this experience? Something about yourself that maybe you didn't know before?
I guess just how the essence of nursing, how it's such a big part of my personality, and it's to the core. And I never realized what an impact my job has on every day, and the healthcare and how it all ties into everything.
Dr. Brantley?
I think a long time ago I learned a lesson that God will give you what you need to be faithful to Him, and this experience has made that lesson very real in my life. I've recognized the depth of what that really means when you're facing death and you know nothing can separate me from the love of God, not even death. What else do you really need in that moment? That's been a big lesson for me.
How about you, Amber?
I've learned that my job, my passion, I can affect so many people more than just the one patient that I'm caring for. My experience and what we've learned and been through since all of this, it affects people all over the world.
This entire experience, especially with the two of you, but I believe you had this experience as well, you've seen some of the best and some of the worst of the American public and how they can react to something as frightening as this. Some people reacted with anger, some with expressions of fear, but a lot of that was aimed directly at you and how you handled that. How did that affect you?
I heard a lot of the very bad parts, about me being on the plane, but I had no symptoms at all while I was on the airplane. So I knew that there was no way any of the people that they were monitoring could have gotten Ebola, because at the time I could not spread Ebola. I feel like the information that the public got from the media, it made them more fearful than understanding. If there would have been, someone to come out with a strong stance saying, you don't need to worry. Amber didn't have any bodily fluids outside of her body on the plane. There's no way any one of you could get ill. It would have comforted a lot of the people across the nation.
We talked before about this anger that kind of surged forth, and you said, well, maybe it's not so much anger, it's fear manifesting itself as anger.
I think that is the case. I was really unaware of media coverage and the American public response to my evacuation back to America until I had already been in Atlanta for a few days and had started recovering. The negative things that were said with regard to Nancy and me coming back to America my perspective on that is that those people don't know me. They weren't talking about Kent Brantley. They were talking about an idea and a philosophy, and a lot of that was coming out of fear. And so I don't take it personally.
Nina, what is it like to have your life kind of play out on live national television, your dog scrutinized and your dog become this famous figure? How does that affect you?
It's been life-changing. One day I'm just a normal 26-year-old ICU nurse walking my dog, and the next minute you're all over the news, headlines, international news. It's been very overwhelming at times, and it's just changed my life.
Part of the reason we're working on this project is to talk about the impact that the three of you have had. We refer to it as uncommon impact. It's something that goes beyond what we all do in our normal lives, a little step beyond that affects the lives of others. How do you feel that you've had an impact through this experience on other people's fates and fortunes?
While I was in the hospital, I got cards from a range of people, and what stands out to me are the notes that I got from young children, like 9 and 11 years old, and they were telling me, that I inspired them to want to go into nursing, and that it really changed my perspective. Like, I'm making an impact on even the youngest people out here.
Dr. Brantley?
People have labeled me as a hero or an idiot or an angel, and really I don't feel like any of those things. I feel like I moved to Liberia to serve people because that's what Jesus does. And when I survived Ebola and I got a phone call saying, would you be willing to donate your blood to somebody else who's sick with Ebola? That's a very little thing that costs, it's a very small thing that cost me very little and could have a huge impact on somebody. So how could I withhold that when I have the power to give it? So I think all of us have opportunities and the ability to make a big impact on people's lives by just living our own lives well.
How about you, Nina?
I think I've drawn upon the overwhelming support from everyone and the comments that I get that we've been so inspiring, and what we do, they appreciate what we do as frontline caregivers. It's just giving me a whole nother perspective on life and how much our everyday work affects everyone else, and how people put their trust in their lives in our hands. And so it's been a very humbling experience to see.
And then there was, of course, after your experience, the moment where all the way up to the highest levels in Washington, there was a reaction in response that this had kind of woken something up in America, that Americans became aware that this wasn't just a problem in America. There was a much bigger problem over in West Africa that Americans hadn't exactly been paying attention to. Do you feel, Dr. Brantley, that your experience had an effect on the reaction in Washington?
I hope that my experience had an effect on the reaction in Washington. I think we all recognize that we live in a global community, but until something like this happens, we don't really recognize the reality of that, what it means. And we talk about the virtue of loving your neighbor, but we don't often consider that the people on the other side of the world are our neighbors, and the way we live impacts them.
You've all been in those sad situations where you have to deal with end-of-life situations with patients. And all three of you have been in the opposite situation. You've been in the position of the patient having to deal with those end-of-life questions from the people giving care to you. How did you react to that, Nina?
I think it was just very shocking when my doctor came in and said, Nina, I know this is an uncomfortable discussion, but we need to talk about end of life. And it was just, I just couldn't believe it. You know, we do this, I do this every day. We talk to other patients about end of life, and you don't really think it'd ever happen to you, especially being 26. And 3 days prior, you were totally otherwise healthy. It's just taken me to a place that I never thought I'd go to, and it's given me a greater appreciation for life, and understanding that life is so short, and I'm just thankful to have a second chance at life.
I never got the end of life talk. I knew in my head it was, you know, a possibility that we would have to, you know, have that conversation at one point. The experiencing nursing from the other side as a patient for me was difficult to do because it's hard for me to turn my nurse off. I always wanted to do what I could to help, and but my staff there at Emory, they were great, and they let me do little things, you know, to help along my nursing process there. But it gave me a greater appreciation for what patients go through, because something as small as sitting up in the chair after being in the bed for several days was like the highlight of my week at one point. So I appreciate the small things.
So these two only dealt with one Ebola patient. You dealt with at least 16 who were tested positive during the time that you were in Liberia. What was it like for you to have dealt with all of those patients, watched them go through the various stages, and during the time you were there only have one survivor, and then all of a sudden you're on the patient's side looking up at these people who were covered from head to toe in protective gear dealing with you? What was that experience like as a doctor?
It was very lonely. It was a very lonely experience. And although I had tried to have great compassion on my patients who had Ebola, I don't think I understood the magnitude of their loneliness and the impact of that isolation on them mentally and emotionally. And that stands out to me.
Well, Dr. Kent Brantley and nurses Amber Vincent and Nina Pham, thank you so much for being with us today.
Thank you.
Thank you.